Well, good afternoon. I'm Irvine Mayor Christina Shea. I want to thank all of you for joining us today for our first ever virtual town hall meeting. I'm here with Vice Mayor Mike Carroll, and we will be answering your questions and sharing important information on the city's measures in response to COVID-19. So right now, I'll turn this over to Vice Mayor Carroll.
Oh, thank you, Mayor Shea. And I just want to say thank you, Mayor Shea, for your leadership in helping put this town hall, virtual town hall together. And it's a real privilege and honor to be able to do this, especially at this time of crisis, to talk with residents, to answer their questions. And this is something, as we talked a few days ago, that I usually do in my professional practice online. And now the whole world is being accustomed to WebEx and Zoom and getting together with technology. So we thought we would give it a whirl today. It's our first time, so I would just ask everybody, please bear with us.
And it's my first time, too. I've never done that. You've done this professionally for many years, so.
And we're really glad that you're doing it, Mayor.
I'm very pleased,
you know,
too.
This is wonderful. So we're really excited to kick this off. And, I mean, we have a lot of questions to get through and a lot of things to talk about.
Yes, that's for sure, and I'm looking forward to it. At this time, I'm going to turn to our city clerk, Molly Perry, and Molly will be mentioning just some protocol that we'll be dealing with today and calling up the questions for us to answer. And what time frame are we looking at for the public? Around 45 minutes?
Thank you, Mayor. 45 minutes is the time frame for our questions, and thank you both for hosting this town hall meeting. And we've received over 100 questions from members of the public. As I just said, this afternoon, you're going to have 45 minutes to respond to the question, but we do want to make sure the public knows that if you don't get through all of them, we will be uploading the questions and the responses to the city's website immediately following this town hall. And if I may begin, Mayor, with your indulgence, the first question this afternoon comes from the Honorable Dr. Stephen Choi, Assembly Member in the 68th District. And he wanted to know, would you make masks more easily available, either free of charge or at low cost for citizens when the funding becomes available from the state and the federal level?
Thank you, Dr. Stephen Choi, our former mayor. I'm so pleased that you're participating. I know that you are an Irvine resident. And yes, of course we will. We're looking for federal funding, state funding to be coming to our city very shortly. And I know there's a lot more independent providers that are providing masks for us in our community. We're posting those businesses online so our residents can go and click on and find where they can get their cloth masks. But certainly if we get the funding, we will certainly provide that. I do want to share that 2 weekends ago, because it's been my top priority, to making sure our city is safe, as our council members are joining me as well. And we were donated by our Chinese community over 9,000 masks. And so on a Saturday, I was out at the food bank with Vice Mayor Carroll, Council Member Kuo, and Council Member Khan, and we said, let's talk about taking these masks out ourselves. So we got in our cars, we went around the entire city, the whole day. Remember, we went to Nectar and got a drink. We were tired walking around. And we passed out over 8,500 masks to every grocery store and every pharmacy in our city because we are personally committed to ensure that we have everyone wearing masks. So hopefully that answers your question. Did you have anything to add, Vice Mayor Carroll?
No, only, Mayor, that it was a great weekend. It was like a weekend of service for everyone, and for us to go out there and be able to do that was really just it was very fulfilling, you know, emotionally. The one thing I think about is we did Culver and Michelson, and we did the Rite Aid, then we did the Ace Hardware, then we did the Wholesome Choice, and then as I was driving away, I had about 15 masks left of the supply for this area. And then I saw the dry cleaner's office door open, and I said, you know, and I saw the guy at the front. He was at the tailoring area doing the tailoring, and there was a line out with distancing was just starting.
Yes.
And I said, I stopped my car. I may have parked correctly. I don't remember. But I jumped out with the mask, and I said, excuse me, sir, we're handing out these masks. And he said, he said, you know, yes, I would love them. And I handed them to him, and he said, thank you so much. I had tried to order these masks for my business and for my employees, like he said, 3 or 4 weeks ago, and they still haven't come in. And he had just had this look of gratitude, So it was, for me, that was the high point.
And I also experienced that at Meg's Donuts. The shop owner has everyone, in line 6 feet back. And I said, would you like masks? He goes, oh, I wish I could get some. I said, well, here's a box that we've received from our volunteers in the community. And he was so excited. And every time I go by Meg's Donuts now, I see him with his mask and his staff. And so it's very fulfilling to know that we're doing hands-on efforts for our community.
Right.
Vice Mayor, this question is for you. Why are you not requiring all members of the public to wear masks outside of their homes?
Yeah, that's a good question, Molly. And we've received that question from a lot of people,
Yes,
Mayor.
we have.
And I'd ask your thoughts, too. Look, the city's been really thoughtful and really measured with their response on this health crisis. I am just sort of reminded of this axiom that when a major decision is made, if everyone is in agreement with that decision, something is very wrong. I mean very wrong. So the point is that what we're hoping for is that we get to an environment where we're making the right decisions for the largest group of people. We have 280,000 residents. These face coverings are strongly recommended for everyone in a public setting, but in certain settings, they're required. They're required for patrons. They're required for employees. And I'll just, to be careful, I have my list: grocery stores, restaurants, pharmacies, gas stations, self-storage, drive-up storage locations, convenience stores, postal services, and dry cleaners, as we just mentioned, that we were handing out masks to dry cleaners. We've really been out front on this one, and it hasn't been an easy decision. A lot of these decisions that we've been making since the mayor brought us together to declare an emergency a few weeks back have not been easy decisions, but we stand by them. We're proud of them, and we do think they're going to help protect the largest number of people in our greater community.
Yeah, and I think, and I appreciate that, I think one of the arguments I was making the other night on Friday night at our special meeting, it's nearly impossible for us to enforce a law that would say everyone has to wear a mask. I don't know if you've been watching the news. I was watching the news last night in one city. They mandated everyone has to wear a mask, and there was police pulling this fellow off a train and put him on the ground and put handcuffs on him because he wasn't wearing a mask. And we've seen several different pictures of this going on throughout the country. We don't want to create that type of enforcement. How do you enforce 289,000 residents to be wearing masks? That means their children. We're going to give everybody tickets. I just think that we really approach this in a very balanced and measured way, as you suggested. We believe this is the proper way. We have mandated by law that you need to stay 6 feet apart. Right. So when you're out on our trails, you're in our parks, that you're observing that. But just the implementation and enforcement would be completely impossible in many ways, and we don't want to be hard-handed and difficult. This is so hard on everyone anyway, but we are asking you to be considerate of your neighbor, your family members, the residents in the community, but it really should be focused on where we congregate, and that is all these different venues you mentioned. And as we congregate, we have to be very, very cautious and careful about what we're doing to others and what they're doing to ours. And I believe that was the approach we took, and I think it was a proper approach.
And those are the only places where we really should only be congregating, in those locations.
Exactly.
Everywhere else, we're apart. Yeah.
Exactly.
Mayor, this next question's for you. How do you expect every person to be equipped with facial masks or coverings when there is a shortage worldwide?
Well, that's a very good question, and I would say 6 weeks ago, I think the question was very important, and it would be a difficult question to answer. But because our supply chain has expanded immensely, folks are going, they're all at home. Many people sew, I sew. Many people are now sewing home masks and making masks at home. There's a grandma here in Irvine that's making them. I know there's people I've been reading about in Costa Mesa around the county are making cloth masks. There's someone from Torrance that I was told they had a swimsuit company, and because they believed they needed to shut that down, they've now kept their employees on, and now they're making face masks out of swimsuit material, which is cotton. So actually, I think the supply is much more expanded. And as I said, if you go onto our website, you'll see that there are opportunities there for people to buy masks very inexpensively. And we're being told that we should be getting a lot more masks being donated again to the city. And if we do have masks that will be donated, we'll make sure, especially our disabled community. I've been getting emails that they're concerned about that. And Molly, do we have our number? It's 724-7200, is that correct?
Yes.
That folks can call into that number, and if you need a mask, if you're disabled, you need help or support, please call that number. But I hope that answers your question.
And Mayor, if I could also provide another number, it's 949-724-8520.
8520, is that our ombudsman number?
Yes.
Okay, great. So that, and then the other is 724-7200. So there's two numbers that our residents can call in and get some help and support if they need a mask, especially if you're disabled. We're not passing out masks to everybody right now, but if you're in a certain category and you need the mask, we certainly will provide that for you.
Vice Mayor, this question is for you. How do I report a business that is not compliant with wearing face coverings?
That's a great question. I think that it's important for everyone to know that we don't, any of us, including us here at the City Council, do not need to be taking the law into our own hands. If we see noncompliance, whether it be certain active, and we'll talk a little bit, maybe a lot of questions about recreation, whether we see active recreation at our parks or congregations of larger people that are not related, or a situation regarding masks where there's not compliance going on at these establishments where people are together, just call the hotline. We have a hotline that the mayor has established for the benefit of all the residents of Irvine. It's 724-8250, 949-724-8250. We actually asked beforehand our technical team, our fantastic staff, to see if they could broadcast this below. On the rerun, we'll probably do that, but due to technology, when we live stream, we can't have that. But 949-724-8250. Just call the hotline.
That's very good. I really wish we could be interactive. Like I said, I've never done this before, so it would have been nice to be able to see people's faces and have them directly ask our questions. I know our WebEx, we can do that, so hopefully in the future we might have that opportunity.
Mayor, this question is for you. How do people with disabilities acquire resources like masks or other needs?
Well, that's a very good question, and I think I just answered that question a moment ago, but we want to help you. We understand that being housebound is even more difficult for you, and so those with disabilities and our seniors. So again, please give us a call at our Ombudsman line, 724-8250, and we will do our best to provide masks for you, again, based on the quantity and availability we have, but we will do everything to help you. And again, especially for people with food shortages and they're not able to get out, I know the Vice Mayor has been doing so much with our Meals on Wheels, so that would be a need that you would have, and we can talk about that in a moment, unless you want to add something, but we want you to know that we're here for you. Just make the call, and we will do everything we can to help you.
Vice Mayor, this question is for you. Which parks and trails are open during the COVID-19 pandemic?
Yeah, all of the city's parks and trails are open. The community parks are open, and we strongly encourage you for passive use. Passive use versus active use is a big question that we get. What's the difference? Active use is tennis, basketball, soccer, congregating, where you're not in a non-familial way, people are getting together. Again, we're not happy about that. We're not looking to be create some kind of a state where we don't have those things, but we're in a global pandemic. We're literally in a situation where 700 plus people are dying every day in the state of New York. We here in California jumped on a little bit earlier, and we were fortunate to be benefited by that in flattening the curve, as the experts call it. And part of that is remaining socially distant from one another. That means passive recreation. One of the things that came up, and this is where I'm really excited, Mayor, about our government, the way our great community of Irvine works. I'm pretty sure this came in from a resident, and it was a very thoughtful, constructive suggestion. And I'm not sure if it came into your office or my office or something, but they were looking at, I think it was Bomber Canyon Path and Quail Hill Loop
Yes.
being too scrunched up, because the paths, and you walk, often you're on Quail Hill.
Yes.
It's so narrow in there. And I thought to myself, oh gosh, because I've been on some of the other paths and I've been walking around Turtle Rock Drive, and there's plenty of margin.
Yes.
But on a
They're
small
wide
trail
enough,
like that,
yeah.
forget it. So what was really great is Lori Hoffman and the Community Services and the Parks and Recreation team turned all of those things into one way. And
Yes.
then with the creation of distance, and there's signage out there. So Bomber Meadow, Nature Loop, the Bomber Canyon Trail, the Quail Hill Loop. I got a message on Facebook by somebody asking about Portola Trails up in Portola Hills, and or Portola Springs community. Tomato Springs Trail. And we asked Lori, and they're looking at that one, probably doing that. Mariana's, our deputy city manager, is nodding, so it's probably being taken care of. But we're taking all manner of suggestions. So I think this was literally crowdsourced by you.
Well, and the one thing maybe I could add to that as well, like on Easter Sunday, I was with my grandson, who, by the way, is going to Berkeley, just got accepted, so I'm very proud of him. I hope he can get in. Wow. And they will be open. And my daughter-in-law, and we went across the street, because I live right across from the Quail Hill Loop, but it was closed. And I was frustrated. I thought, why are we closing the trails when we have not given that order to do that? Well, I found out that the reason some of the trails have been closed is based on the Irvine Conservancy closing them because of the rain and that the ground is soggy, not because we've closed our trails.
We haven't closed anyway.
And we're going to ask, I called Lori today, I said, please put signs out to talk about to the public, stay 6 feet behind one another, but the only reason they would be closed is based on weather. And, as you know, I'm a big exercise proponent. I believe it's very good for your health, especially when we're housebound. Get out and walk, get out and hike, do your cycling. It's so good mentally and emotionally and physically for your body. So we didn't want to close our parks. We're not going to close them. We have, taped off the children's tot lots because the germs will stay on the metal and even the plastic for many days, and we just want to be super protective of our children. But basically, all the parks for passive use in our open space are open to the public, and we want you out there. Just be smart. Give everybody 6-foot distance. Give them time to take off, and then you follow. So I think that's just a good policy and very measured as well.
Mayor, this next question is for you. How can someone volunteer?
Well, that's a very good question. It's difficult from the standpoint that because we're sequestered at home and we have the stay-at-home order, which is not ordered by the city council, as the governor has ordered this as well as the federal government. So there are opportunities. Many of those opportunities are actually to go online and to, if you could monetarily support some of our organizations like United Way, the Orange County Community Foundation, also the Orange County Food Bank, our Second Harvest Food Bank. We have Meals on Wheels. That is so important. If you can get out and wear your mask, we have, you can contact the city at 724-8520 or 724-7200, and we can use more volunteers because we're putting people on lists now that need food, and we don't want people on lists. We want to make sure everyone is taken care of. So we would love you to call the city and see if you could volunteer for our Meals on Wheels. Make sure you have your mask. You take your sanitizer with you. I have it in my car, I have it in my house. Everywhere I go, I'm putting sanitizer on. At the end of the day, I'm going to have to get a nice, I'm going to have to go and get my nails done and get, because my skin's getting so dry, putting this, the sanitizer on, but it's for a good reason. So in our Families Forward program, we have that. You could go online. We have quite a few online. I believe, Molly, is that not correct? That people can go on our Facebook. We have Facebook, but also go on our webpage and look at all the different organizations we support and reach out to them, give them a call. And I know that they would love to have your support and help. And thank you for asking that question. It's so important that we are all thinking about others and not getting too frustrated at home. And but when you think of others, your life is a lot happier too. So thank you for that question.
Vice Mayor, this question is for you. What if I need childcare?
Yes, childcare, critically important, particularly for our workforce that is still out there doing essential functions that are still critical to a functioning community and a functioning, county and state. We take that very, very seriously here at Irvine, and even personally myself as a parent of young children, child care is paramount. We have actually partnered with child care agencies throughout the county. We've also surveyed all the providers as well in the last few weeks. We have a list posted on the city's website. It's a Finding Childcare page. Is that? Yeah, okay. Finding Childcare webpage. And there are some 20 or so child care providers in Irvine. They're operating. We know that they have availability. If it's possible, if the technical team can scroll that or the webpage address or something on the screen, that would be great. And the rerun will definitely put it on there, but really critically important. So I can't stress that enough. Please call our hotline if you can't navigate the website to get the child care that you need. We'll find it for you.
And may I add, Vice Mayor, just for a moment, that's something that was brought to our attention about 3 weeks ago, and I started working with staff. We reached out across the county. We're able to get numbers, catalog all these different child care sites, and many of them have availability, especially for our first responders and our nurses and doctors, so, and those that have to go to work. So there are availability, and you're right, they're on our website, and it's something we really want our community to access.
Mayor, this question is for you. What if I have questions about COVID-19? Is there someone at the city I can call?
Yes, and I think as we go through the day, this next half hour or so, you're probably going to get some repetitive answers. But yes, just call the city at 724-8520. And at the end of this WebEx, we're going to ask you a trick question. What are the numbers you're supposed to call? Or 724-7200. But of course, weekly too, we are having our press conference. I just am finishing up our press conference today that will go online on Facebook and YouTube. And that gives us regular updates from our city, from the mayor, from Vice Mayor Carroll, our chief of police. And also we always host a different medical expert that comes on with us during these interviews. So they're always very important to get on our webpage and look at all the updates on YouTube and Facebook, Irvine Facebook, and you can see our most recent update for our press conference. So, so hopefully that's helpful, but again, we're trying to be as open as possible, even though some of our employees are at home, but that's why we come in for council meetings, we come in for these special events, because we want you to know, and we've sanitized everything, so we want you to know we're being very careful, we're 6 foot apart, but we want you to know that we're still active, we're here for you, and the city is running every day. So thank you for that question.
Vice Mayor, this is for you. Who can businesses call if they are in need of aid during the COVID-19 pandemic?
Yeah, Irvine, as you know, and we talk about it a lot, is sort of the backbone of Orange County's economy in so many ways, with so many of the county's largest employers and innovative companies and technology companies and professional services companies calling the great city of Irvine its home. If you're in any need, there's a lot of places in which you can go. The city has an economic development hotline. Again, another number. And I told you, Mayor, that this would be somewhat like, almost like a telethon. Yes. Because we would be going back and forth, and there'd be a lot of things on your screen. And so we're not raising funds. We're just raising awareness and trying to provide comfort to people. And you know, God willing, we're doing that. So these businesses, here it is, 949-724-8655. That number is 949-724-8655. That's our economic development hotline. We have Caitlin Wynn. She's our coordinator of economic development at the city. If you haven't already found, as a small business, a medium-sized business, any size business, haven't found the help that you need through the SBA or through the Chamber of Commerce or through the city, please call and we'll get you directed help right away.
Good point.
Mayor, this question is for you. What about rent or eviction or utility payments?
Well, that's a broad question, but I would understand that there is a suggestion which has been a very big concern to so many residents. Every day, I'm getting letters which by law is required. We have 8 to 10 letters every day that businesses are closing, which meaning their employees are out of work or they're furloughed. And we're going to be discussing this on April 28th at our council meeting, totaling up all the employees that are out of work. So consequently, that puts a huge burden, as we all know, on families, on keeping your rent payments up, your mortgage payments up, to pay your utilities. We don't want anyone having their water turned off, their utilities turned off. So all of our utility companies have confirmed that they will not be turning off any of your utilities. And if you have any problem, again, call one of these numbers we've suggested. When it comes to evictions, our city council at our May 28th meeting, we ensured that we would have a restriction on any evictions in our community, and that goes to the end of May, on May 31st, but we will extend it depending on how we're looking at this virus, so we're able to open back up and people get back to work, but there still is going to be a lag time, and we understand that. So consequently, we're doing everything we can to ensure that you will not be evicted, you won't have your utilities shut off, and that we're here to look after you. I mean, a lot of people say, you know, government should not be in the business of our lives all the time, but when you get into something like that we've gotten into that none of us foresee that came about in 2020, this is something that government can do. If we look back in the 40s under FDR, when there were so many problems, they instituted some very aggressive efforts to protect the community when it was so awful during those days when people were in bread lines and they couldn't get work. So hopefully we will never get to that point. But this is a similar approach we're taking to make sure we protect our community.
If I could just add to that
Sure,
also,
please.
and it's just a small thing, but as people are kind of reaching out and thinking about what we're doing at the local level, then there's the county level, and then there's the state level. Well, just yesterday, to the point about rent relief and utility help or deferral or rent, the insurance commissioner of the state ordered auto insurance companies yesterday to waive or defer or credit March, I believe it is March and April auto premiums. So if you haven't already,
I
call
didn't
your
hear that,
auto
and I
insurance
could use
company.
that, so that
it just
sounds
came,
great.
I know. And you and a lot of other people in the city will benefit from that because basically no one's really been driving. So the insurance commissioner had the authority to do that. So please check the mayor's Facebook, my Facebook, our council colleagues, Councilmember Quo, Councilmember Khan, Councilmember Fox, and of course our city Facebook, because we just keep moving with this new stuff. And isn't that amazing? It just came out, and you're on top of so many things. As a group, we're actually pulling all this stuff together, all these ways in which if you add up the rent help and the utility help and the auto insurance help, it will mean something.
And you know what's so refreshing to me is that over the last year or so, just the political dynamic has been really so ugly. We all have to know at the federal level, even sometimes at the state, even locally, at times it can get very, very ugly and demeaning one another. And it's just so refreshing to see that people are coming together, all parties. It's no longer anything about politics. It's about caring about you as a human being on that very base level. And that has been very refreshing to me. Yeah. Even though we don't want to be here, we know how awful this COVID-19 is on so many families and the damage, but like a little bright, fresh light coming into the room for me has been that we're really working together, and it's just showing through some of these benefits that our major companies are offering.
That's wonderful.
Vice Mayor, this question is for you. How can I donate personal protective equipment, also known as PPE?
Good question. We've received a number of inquiries here at the city, probably all of us at the council. I'm sure our mayor's probably received most of them, our city manager, our police department, and how they can help and how they might have supplies they can donate. I've even seen things on Nextdoor of a neighbor, and we had my staff member, Steve, grab that person who I guess for some reason has masks and needed to check if they're N95 or capable. So there are places here in our city where we can receive those donations, including here. And I would just note that we have Kaiser Permanente and Hoag are accepting these PPE donations. So if you have quantities for whatever reason of these items at home or in your office or in your self-storage, please pull them out. You know, if there was ever a time for this stuff is needed, it's right now. So please bring it over there. And then there's some contact information as well. And then you can also contact City of Irvine Hotline, we keep mentioning, 949-724-8250. Call that number when in doubt. And particularly if you have PPE equipment, they can push you to either the Hogue people to where to donate, which I'm assuming it's going to be the center, either urgent care or across the street at the hospital on Sand Canyon, or Kaiser Permanente across the street on Alton, or our own emergency operations center, Bobby Rush, who's it's activated right now. It's open. It's right up here.
I was going to mention that. I thought if people have extra equipment, they just can come over to the front of the police department, and if you put a little note, just put your box there. We'll make sure that we'll check every day if there's something left out in the front area. If you want to donate your PPE there, that would be fantastic. Whatever you can do to help us, and then we distribute it to our first responders, our fire department, our police, and also UCI is asking for donations as well. So we want to make sure that, number one, all of our hospitals are covered. We've been passing those out. When we went out to all the grocery stores, I forgot to mention that we also passed out masks to Kaiser and to Hogue Hospital as well. That was actually the first step that our volunteers took.
The first stop.
Mm-hmm.
Mayor, this question is for you. How can I get tested for COVID-19?
Great question.
That's a very good question. I think a lot of us would like to get tested so we feel a little bit more secure, especially this time of year. I have my allergies, so I'll sneeze and I cough a little bit. I don't have a fever, but so I know people can get concerned and anxious, very anxious about, do I have the virus or not? And of course, a lot of people want to know maybe they have the antibodies, and so I know that the federal government's looking to get as many tests as they possibly can to all communities so we can all get tested. It's not there yet, but it's supposedly coming very soon. But let me say that Hogue Urgent Care, let me give you that number. Number one, the most important thing is to contact your doctor and share your symptoms and certain areas that you know, your age group or whatnot, and they can determine if you need to go in and get a test. A lot of our doctors are not even having us come into their office. They're doing it, you know, visually, or kind of like what we're doing here. But call Hogue Urgent Care, 949-791-3000. Again, that's Hogue Urgent Care, 949-791-3000. Kaiser Permanente, 1-877-813-7297. That's 1-877-813-7297. And then UCI, they're doing testing, and that number is 714-456-7002. 714-456-7002. I've been working with mayors around the county, and also reached out about 3 or 4 weeks ago, and we did identify UCI. If you have a prescription, they will test you. And if you have a prescription, you can call the Hogue Urgent Care, and they will diagnose you over the phone, and then you can drive up to the urgent care that's on Sand Canyon across from the hospital, and they will test you. The nurse will come out, and they will test you there and get you the results. So if you really are feeling very sick, you need to get tested. If you aren't, it's difficult to get tested right now because they're trying to save all the limited tests that they have.
Yeah,
yeah,
and
the
I have
kits.
some information on numbers
Yeah,
too.
so if you have some more, that would be great.
And this is just information that was shared to us at our last press conference by Dr. Bowden, who is the dean. She's the dean of the UCI School of Public Health. And if you didn't catch the press release from last weekend, let me just, Monday, let me just take a quick snapshot and read some of this. As of last weekend, because I know people really do like information and like to know, and I'm glad that Mayor Shea just mentioned we have a definitive location in Irvine that you can go and get a test. You just heard it here. What is the statistics? There's up to 400 plus per day that the county is able to generate. There is apparently a 45-minute test and a 60-minute test, and she reported that antibody testing would be coming soon. So there's 2 platforms that are used. One's called ePlex. The other one's from Abbott Laboratories, the pharmaceutical company. And we're at a capacity that the county can run 400 plus tests a day. As I remember, she reported that number is just increasing.
Because they were only doing like 50 to 80, and it's difficult to tell by the numbers how many cases we actually have because people are not getting their tests.
And it greatly restricts the test, like who gets tested.
Right.
I think that's really, it seems like that's really calmed down and more people can have access to it.
Right, that's a good point.
Vice Mayor, this next question is for you. This question comes from Cherry L. Can you make clear the recommendations for wearing face masks while walking or exercising outdoors? My understanding is that as long as 6 foot of physical distancing can be maintained, face mask is unnecessary outdoors.
Yeah, it's a really good question, Molly. So, and let's just be honest. I mean, we're not the all-seeing up here. The mayor and I don't have all the answers. Our council doesn't. So many of us, from the governor, from the president to the governors, on down to the local communities like us, we don't have all the answers. So I don't want to try to pretend that we have them. And that one is a great question, and one that I almost didn't want to answer because it's a challenging one. The city continues to advise that the use of face coverings, when practical, needs to be used. But it's not a substitute for these other measures. And the most important measure, as we know, as the mayor started with in the opening, was the 2 big ones: social distancing and washing of hands. And I've heard it a million times. I think it was, again, Dr. Bowden said, you sing happy birthday twice or something? There's a time that, what is it again, when you wash your hands, you're supposed to sing happy birthday 2 times?
And then ABCs, right?
ABC,
Just the little
yeah.
kids, my granddaughter does A, B, C, D, E,
Right.
F, G.
So it's not so it's a long enough washing that you're
Yeah,
getting
right.
off what you need to get off.
Exactly.
So that's what we would say on that one. Great question. We understand why you would ask that.
Mayor, this question is for you. Do you have any information regarding the village communities that are the most affected by COVID-19?
Actually, I don't. And the reason we don't have those numbers is that the County of Orange is, our health department at County of Orange, they oversee all these cases. It took me 2 or 3 weeks to even work, when I was working with Supervisor Wagner, to even get the county to start sharing how many cases we had in Irvine. Eventually, they have come out over the last 2 to 3 weeks, or 2.5 weeks, to share with our communities in Orange County what cases they do have. But to suggest the villages or locations or zip codes, they are not providing that information whatsoever. There are HIPAA laws that protect individuals that are sick, and I think they want to be extra conservative and careful about that approach. So, yes, hopefully that answers. Do you have any other comments you wanted to make?
No, I think you said it. You said it best. It's again, it's a real challenge. I get that question a lot too on social media. But our villages of Irvine are neighborhoods, and doctors are allowed to ask what they're allowed to ask as far as information. So.
Yep. Good.
Vice Mayor, this question is for you. Can you notify us of actual hospitalizations by age group? Are you able to add further context to the numbers?
Yeah, thank you for that question. And that question is another multiple. I've received that as well on my Facebook page. That information is apparently put together at the county level. And again, to Mayor Shea's point about HIPAA and privacy, and again, we don't make these rules up. These are federal laws that have to be followed with respect to patient privacy. So it is allowed to be put together as far as data at a county level. And I had provided that day's summary from the county website to that one resident that had asked me online. So I would just say there's the COVID-19 site at the county. The city information won't provide that, but the county website will provide hospitalizations by age. And for what it's worth, we have currently, as of yesterday, 103 people hospitalized in the county of Orange for COVID-19, and 51 of those people are in the ICU.
Mayor, this question is for you. Will Orange County and/or Irvine add additional stay-at-home orders similar to other counties?
That's a very good question. At this time, we certainly aren't looking to do that. I don't know if local governments like councils or cities are going to be even considering that. This really will come from the state of California. Some counties do step in. I do not see our county real proactive in making a lot of determinations. I think they're staying very cautious and careful. So we will just wait to see when the governor's stay is up. And yeah. Vice Mayor, do you know the date on the governor's stay? Is that in the middle of May? I've lost.
Yeah, that's a great question because everything keeps moving.
Yeah,
Los
the county
Angeles
was
said May 15, but
right.
I don't know if that still means that the state is April 30. But it is somewhere between April 30th and May 15th, and the president has said, I believe, April 30. And I think that's where he that's where he is federally right now.
I
So
think
it's
they're
all- 'cause it's
taking
all
it day
just-
by day based
Yeah.
on the caseload and how everything's being monitored. I know the county was suggesting March 31st, but of course that's passed and now we're under the state mandate and directive. Again, I don't want people to stay in their home too long. We know it's just really devastating on our county. But ultimately, it really has to do what the best for the public health is. And that's where I believe our city will certainly follow suit, but we will not be making that directive. If, in fact, there's certain implementation programs that we need to stick with as we move forward, if we notice our cases, really expanding, of course, we will directly deal with that. But generally, the stay-at-home order would be suggested through the federal and state governments.
There usually, for me at least, I find comfort in numbers, and these numbers really do speak volumes as to what we've done as a state and a community down here. The state of New York, sadly, has 202,365 cases of COVID-19. 202,365, and 10,834 people have passed away. In a state far larger in population, this state of California, we have 24,438, and 732 have unfortunately passed away. And that's nothing to be, gleeful or happy about. But
No.
It's amazing to me, Mayor, when you look at the comparison.
Yeah.
And there are probably a 1,000 different factors that go into that. But these tough things that you talk about, staying at home, we're all going crazy at home. We're all scared. I mean, let's just admit it. We don't know what the next days are going to bring, but take faith, I would say, if you would, in these numbers, in the sense that you really are, each house is doing its part in keeping these numbers down. It's just as clear as day right here.
Well, and you look at New York, that they're having 780 deaths a day. Can you even imagine? It's just something that you can't even imagine. And I've done a lot of research on the flu from 1918. If you read that, they had 50 million deaths and 500 million people affected globally. It was huge, of course. Right. But even then, they didn't have penicillin. They didn't have any support. But a lot of what goes on, especially in New York, is the congregation. People live on top of each other. They're so close together. We're very lucky in Irvine because our community is spread out in 66 square miles. So in a sense, by us staying at home, it really keeps those numbers down, and we're very privileged to have the kind of community we do. So, right. But it doesn't mean that we just, and I get emails from people, why are you doing this? Very angry, we want to get out, we want to go back to work. But there is a reason, and it is to keep us safe and healthy. Hopefully within the next 30 days, things will turn around. We'll be able to carefully and cautiously go back to work. I would be of the mind you still should be wearing your mask if you're going back to work, you're going out in public around people, just to be assured, because we don't know if this is just going to come back. No. Because the flu of 1918 was almost 2 years. It went away, then came back. So we have to be very careful. And again, I know a lot of people don't like government intruding in your lives, your constitutional rights, exactly, but the concern is, to me, is that has to be overridden, and that's why these state of emergencies, they do override some of our constitutional rights. We don't like it, but it is for the general public health. And when we take our oath as elected officials, we have to uphold, one of the top priorities that we have to uphold is the safety and health of our community members, and we take that seriously.
We really do.
Mm-hmm.
Mayor and Vice Mayor, we have about 1 minute left, but this is a really important question that I want to give to both of you. How can the residents of Irvine access daily information regarding COVID-19? What communications are used to provide this information? And this will be our last question.
Great. Well, I can kick it off.
Go ahead.
I
think she was addressing you, but I think it's a similar question we just answered, but go ahead.
I can't, we forgive everyone, first of all, for this going so fast. We will have to come back and do it again, and we hope this was helpful.
I would like to see if we could do this every week until we get through the...
Yeah, I mean,
it might be something helpful if people enjoy it.
And we hope we can make it more interactive, too. And look, Molly, thank you for ending on that question. It is incumbent upon us as public officials of one of the greatest cities in the United States of America, I dare say, to be out there. And our job is twofold. It is to communicate and to comfort. And on the latter, we're doing a lot of comforting with your council and your staff. 1,400 city employees are out there day in and day out helping people, Meals on Wheels, the congregate meal program, delivery of groceries, picking up prescriptions. You call that hotline, we will get you help. We promise you that. On the former part, we have to communicate. We have to inform our residents, and we take it very, very seriously.
And this is part of what we're doing today.
And we're very excited about it.
Yeah.
You know, be on our Facebook, be on our social media. We're even on, our city is on the Nextdoor platform. And we would just mention one other thing. Actually, Mayor, I would like you to, if you would be kind enough to talk a bit about the mailer. We're doing a stay-at-home handy reference mailer.
Yes, we decided to do that approximately a week and a half ago, and it's going to go to every home because especially our certain populations like our seniors, they're not on social media. And so they tend to get more isolated, and we really have major concerns. My mother's 93. She's in a retirement home, and she calls me 3 or 4 times a day. And I try my best to be very positive, but they just get lonesome, and they don't always have access to information. So we said, we're going to need to put together a postcard, and we have, and it's got all the information, contact information. That should be out in the mail pretty soon. This week it should be in your home, and it will have all the contact information you're going to need, some updates. It's double-sided. So make sure you check your mailbox and you save that card. Put it near your phone. And again, if there's ever an emergency or anything, you always, first of all, call our first responders to come help you. Call your hospital, your local doctor. But of course, these numbers are there for your help as well. So it's really been a wonderful opportunity, and I hope that we can do this again perhaps next week if you all enjoyed it. Yeah. I'm so sorry we couldn't get to all of your questions, but what we will be doing is adding these questions online on our city webpage and making sure that we have your questions and your answers. And thank you so very much for joining us today.